Let's say somebody just, Mary off the street just went to her GI doctor and she just got diagnosed with Sibo. And there's a million questions running through her head. First of all, let's tell everybody, what is Sibo and how is it viewed in the more conventional medical sense and also in the integrative field? And then we'll get into some of the things that we have noticed about Sibo and the things that we kind of go against the grain on. So first things first, what does Sibo stand for?
Yeah, so Sibo stands for small intestinal bacterial overgrowth. So as the name states, it's basically like an overgrowth of bacteria in the small intestines. I almost view it as an imbalance of bacteria in the small intestines. Discomfort, bloating, diarrhea, constipation, a blend of both. So it's really driving very IBS-like symptoms. And Sibo in general is very much tied to IBS.
I think that some studies, when they've tried to look at, the diagnosis of Sibo within IBS, some studies are in the low, 20 or 30% range. Of 20 or 30% of people with IBS actually have Sibo. And then some studies go all the way up to 80%. I think that a lot of people in the integrative space estimate somewhere between 70 and 80%, so definitely on the higher end of that.
I think a lot of that is dependent on what method of testing people are using. Go in during an endoscopy and take a culture of your small intestines and then see if you have an overgrowth. And usually those studies are going to have lower levels. And there's problems with those studies.
The thing that's really clinically useful and it's cheap and it's easy to do is going to be the breath test. But there is some issues with getting a breath test done. There's two different substrates that you could use. You'll basically drink a sugar solution to feed the bacteria, and then you breathe into tubes every 20 minutes for usually 3 hours and wait to see if those gases peak. Because that's really the gist with Sibo, is that the way that the bacteria cause you a lot of grief is because they make a lot of gas. So it's a neat test, but it's not perfect. I've been a little bit hesitant to do a lot of Sibo breath testing on my patients because there is a fair whack of false negatives and potentially a couple of false positives with lactulose.
A big problem I see in the Sibo space is practitioners being very reliant on breath testing results. Breath testing results are all they're going by in terms of making decisions on what to do with treatment strategies. And that can be really problematic because there could be a reason why your levels are higher and you might have a false positive. And there also could be reasons why you have a false negative based on your transit times. Or it would be more optimal to work with a practitioner that's taking in all the factors of your case and looking at, what are your symptoms? How are you presenting? Other testing to confirm.
The Sibo breath tests are intrinsically provocative tests, meaning if you have Sibo, they have the potential to make you feel worse. But let's say that somebody got a positive Sibo breath test with GI doctors and even to some extent, people in my profession in functional medicine, there's this kind of knee-jerk reflex that they hear overgrowth and they think, oh man, we've got to nuke it.
Yeah.
And that's where commonly it's all about killing and starving, doing a Sibo diet and trying to just nuke the bacteria.
A lot of docs think, okay, they did the antibiotics, it should be done. We're done. Yeah. We're done dealing with this. Exactly.
Yeah.
You fixed your Sibo, even though someone could be super symptomatic after taking rifaximin, which is the common antibiotic. And I do think there's that. But then sometimes in the conventional space, they're cycling through many rounds of antibiotics because that's their only tool. Again, I wouldn't recommend Cipro for Sibo.
Yeah. But then if you also look to people in the integrative space kind of doing what the conventional world is doing. It's just you're doing it with hippy-dippy products instead of prescriptions. And it's green allopathy. You're using natural products, but in a very similar model. That's not necessarily the most integrative, holistic way to treat Sibo and to treat the individual person. So I see that quite a lot from the so-called integrative space. Going back to the topic at hand, I think that killing shit is a piece of the Sibo journey for most people, right?
Yeah.
there's going to be some degree of, you genuinely have an overgrowth of a bacteria or two or who knows how many. And trimming that back and getting that population more under control is a piece of it. But we also have to focus on the checks and balances that keep SIBO from happening in the first place. Otherwise, you're going to nuke stuff and then it's going to grow, because that's what bacteria do. They reproduce and they grow again. And if you have an environment that allows for that stasis and allows for that growth of the bacteria again, you're just going to be faced with the same issue over and over again.